Hello, everyone, and happy Friday. From the center of the aerospace testing universe, Brigadier General Matt Higer, Commander 412 Test Wing, with you on Friday, the 6th of August, 2021. I am joined by Chief Master Sergeant Dan Thompson. He's my, I'll say, stunt double, designated hitter, whatever the analogy is, Command Chief when Chief Ward Swanigan can't be here. He's also full-time as the Mission Support Group Chief as well. So he'll be hitting me off camera. He'll be reading the questions. I'll flip as many as I can to him, especially the tough ones, Chief, so as always. And then on the other camera, if you could swap that, folks, we have our FEO, right, Public Health Emergency Officer, Lieutenant Colonel Michelle Westy, call sign Highlander. It's such a wonderful combat call sign story. I tell it all the time to everyone. And there can be only one, right, as she stabs the virus with her big sword, right? It's fantastic. So here to answer your questions, here to dialogue with you. The number and the way that you can get those questions in and you can provide us feedback is on the bottom of the screen. It's area code 707-412-8922. Again, 707-412-8922. And literally, you'll watch Chief's hand buzz every time you guys text in a question or a comment or anything else. We have a couple of topics teed up that we want to push to you and want to talk to you about. While those are ringing in, Chief, we got 20 already, or you want me to hit the first topic?
Please do, because we have no questions yet.
So while you guys are getting your fingers happy and clicking through all the links, it is really important to me to highlight a couple things that are still happening. You hear me talk about 4 combat lanes that we're in all the time. We need to make ready airmen today, to deploy today, to fight tonight. That's a combat front we're in. We're in a combat front literally as I talk to you in cyber, keeping it safe, making sure that we're smart as we maneuver in that combat domain, in the cyber domain. We're a test wing, right? Our test mission is a combat front. It's the modernization fight. It's the future fight. It is a combat front. And then there's the fourth one, the COVID front, that we continue to fight through or fight with or fight against. And make no bones about it, folks. It continues to be a combat front. Now, how do we do all that and still succeed? We do it because you're awesome, because we have teams that bond together and are awesome, because we do the right things for airmen when they need us, and we celebrate the highs and we pick them up at the lows. And speaking about celebrate the highs, tomorrow I'm elated that we finally get to execute Summerfest. It is tomorrow, August 7th, at I can't remember the name of the park. It's behind the baseball diamonds, behind the bowling alley near Fam Camp. I don't want to give you the wrong name. Anyway, physically it's where it is. It's where we did the 4th of July fireworks.
Same place.
Celebration on the old parade ground / football field there. We'll start to kick it off at about 1700. Still going to be a little warm. There'll be a couple opening remarks. You'll have folks setting up, and then it'll build up over the first 2 hours from 5 p.m. to 7 p.m. And at 7 p.m., the open air concert kicks off. The venue is there. It'll be a large stage, and we have a couple performers that are there. And then there are some booths. There'll be food booths. There'll be private orgs. Plenty of space to spread out. It's outdoors, so we got that going for us as well. And I will tell you, folks, I got asked multiple times, what about Summerfest? Delta's here. What about Summerfest? So here's my position. My position is that I know that you know what to do, and more importantly, what not to do, right? So if you are going to stand in very tight circles and exhale all over each other, or people that you don't live in the same house with, that's a bad thing. But I'm confident you know that, and you're not going to do that. I already told you it's outside. There'll be reasonable airflow because it is the summer at Edwards. Like, there'll be the 4-letter W word a little bit, right? That's going to help a lot too. And absolutely no harm, no foul, no shame if you choose to wear masks. That will help everybody also. And when I am around or near people inside of the physical separation bubble that we've established as 6 feet, you're going to see me have a mask on, which means most of the time I'm going to have it on. But we have all that going for us. I know you're going to do the right thing. And this is an example where we're leaning on the folks that are doing the right thing, which is all of us. We are in deep gratitude to the folks that are fully vaccinated. And we have mitigations for those that either can't be vaccinated or have elected not to be vaccinated. And that's how we're handling COVID. But we're boosting, we're turbocharging the other side of that equation in that we have to continue to get together as team, as families, as community, because you can't just isolate forever. And I think that balance of team health and individual health is a really big thing that we hit the nail on strongly tomorrow. So enjoy the time. Let's not turn it into a super spreader event by doing individual good actions. If you are at all feeling ill, stay home. And make sure that when you're there, you do good best practices, as I will be when I'm there for the duration I'm there. So that's tomorrow, Summerfest, behind the bowling alley, same place we did the 4th of July event, and it starts at 5, really ramps up at about 7 p.m., and it should be another 2 to 3 hours after that. All right, so that was my big push. Chief, anything you want to push or questions you got, Ron?
Several people just calling in, helping us out.
I
had 4 people tell us Wings Field.
Wings Field. So I thought that's what it was, but I didn't want to say the wrong one, right? So Wings Field is the place. All right.
If I could real quick, too.
Absolutely.
And I'm waiting, they'll get here pretty soon, but they're all over the Facebook pages, and they're all over the social media for FSS, is that we've expanded the pool hours as well at our several locations. So especially the one at Club Muroc. So just so people know, that's another great thing that we have going for us. And then they've also asked that I press out that, hey, we are test-based. So right now what we're doing is we're taking on the new fitness assessment as a beta test. But it's all voluntary. It doesn't count against your fitness assessment test, but we do need volunteers to come out, all age categories in uniform, that wear the uniform and come out and just practice the new test. The new beta test. They're really looking for volunteers.
And they're ready for it. So news to me. So I learned something on these broadcasts too.
I just learned it when you sent it to me.
Great. So we're ready now.
Yes, sir.
At what point does that practice test convert score to my actual testing count?
We have no idea.
We have no idea.
So I asked him. I said, hey, if they do pass and they do well, can we count that? And he said, I wish, but we can't.
Okay.
So they are looking for that. They are leaning forward. They're trying to do, especially our FAC here. They do a great job leaning forward. With the weather monitor down at South Base and everything else, they do a lot of unique things here in the name of test.
Absolutely.
And this is going to be one of them.
Yeah.
And so they're pretty excited. There'll be like flutter kicks,
planks,
shuttles, planks. Yeah, there's going to be a whole different, ensemble. And the more military folks we get out there to do it, and the better the beta test goes, the more chance we have of getting alternate events for the actual official fitness assessment,
fantastic.
Which is what we want.
Yeah, no, fantastic. So Chief Bass talked about that when she was here a couple months ago, that we're moving out on that. So this is another step down the road of we're listening and we're making sure that fitness means you are fit to fight. It doesn't necessarily mean that you do 3 specific events. So that's goodness. One of the things that I want to remind everyone on fitness tests is that they're back on. Right? Based on when your last fitness test was and what your score was, when your next one should be. If you need us to translate that for you, we might be able to phone a friend for that, but it is publicly available. So please make sure you don't miss that, right? Late fitness assessments are still late fitness assessments, and they're unacceptable.
Right.
What has changed, and we never really got a chance to ramp it up because we dove into COVID and put everybody on fitness test exemptions, we never really got to ramp up the diagnostic test opportunity that you have. So if you are someone that the test brings you anxiety, you can go take a diagnostic, and within certain parameters of time, you go there, you get an official diagnostic. If you like that score, you can keep that score, and that diagnostic fitness exam is available today, and I encourage you to use it. I will tell you, if you are on profile and you just come off profile, so for example, I got a bum shoulder, and if I think I can do good push-ups today and I go take my diagnostic because I'm not on profile and I do push-ups and I score well and I don't hurt myself, then I'm going to take that score. The problem is if I wait until I have to do it last day, can't go beyond that, and then I hurt my shoulder, now I run into a whole bunch of more administrative things that were not necessarily necessary. So that's another good use.
Yeah, you'll still be protected in that case because you can go get the medical waiver.
Correct.
But it's going to be a big pain.
It is. So, if it's an official score that you have to met out of, that's a totally different animal than if you show up for your diagnostic. Right. And so that's something that I encourage everyone to go take a diagnostic. And if you like the score, great. Take it.
Absolutely.
Right? I think there's a lot of greatness there. So.
And definitely, if you go take a diagnostic, my personal recommendation to you would be, it's a diagnostic. Make sure you dedicate it to that. If you have time and you haven't done your diagnostics yet, always call it a diagnostic if you have the opportunity to, because you can always switch to official. But once you say it's official, you're done.
Yep.
Even if it is your first time and you have 2 more swings at bat, you're still done once you say official.
Yep. Good to go. And the FAP is very, very excited to be back in business. Chief Ward and I were at the got the first 4 people on the first day of testing again, and I don't know if they weren't excited because it was earlier. They weren't excited because really, the command chief and the boss are here to watch us.
Yes.
But it was neat, and I was glad to see it back up and running. So, any questions?
Okay, so I don't know how much we can say about this. I know the answer to this, but I don't think we can say it in this forum. It says, are we tracking breakthrough cases of COVID, meaning those that have been fully vaccinated and still getting COVID? Are we tracking those on base actively? And I know the answer to that. I just don't know technically what we can say here in this forum.
Yeah. So the answer to the question is yes, we are tracking all cases to include all the parameters of those that are and are not vaccinated. Now, how many and what are the scenarios that we aren't going to be able to release? But this is a good opportunity for us to flip to Lieutenant Colonel Westy and have her talk about the differences that they're seeing both locally and what we're seeing in the region for hospitalizations and deaths, vaccinated versus not vaccinated, and how fast are the breakthrough cases recovering, those types of things. So, Highlander, do you want to hit that a little bit?
Sure, sir. Yes. So yes, we are seeing some breakthrough cases here in Edwards, and the community is also tracking breakthrough cases. Like LA County, I know is tracking some of those numbers. The CDC is tracking breakthrough cases that are being hospitalized and those that may be passing away. But the fact remains that the purpose of the vaccines primarily was to prevent severe disease, hospitalizations, and death. And it is working. It is very effective. Even with the Delta variant, that is a lot more contagious. This variant has a higher viral load, but it is working. The hospitalizations, those who are hospitalized or passing away from COVID that are vaccinated are definitely less than 10%. So that is something that is really, really good news, that the vaccine does really help that. And even the vaccine does still protect you against getting COVID. It's definitely not 100%, but it does help. It does give some protection. So we have been getting breakthrough cases coming through, but the majority of people who are getting COVID right now are unvaccinated. And again, the majority, like over 90%, that are being hospitalized and passing away from COVID right now is unvaccinated, and that's what we're seeing really in California and really in the U.S. nation as well, and honestly in other countries as well. So the vaccine definitely does work, and I would encourage you, if you've been waiting or thinking about it, this is the time to get vaccinated, is now and not to wait. This surge is going to continue to happen, and honestly, the reason we're probably doing as well as we may have been with hospitalizations and death rate is because people have been vaccinated. Really, if people were not vaccinated at all, we would have a lot more cases than we even had in the winter months at this point in time, because this virus is very, very contagious. The virus that had been circulating last year may have infected about 2 people. This one's infecting about 5 people. So it's a really, really contagious virus. And again, that vaccination probably has helped the case numbers be, even though the case numbers are rising every day, it's helped the case numbers not be as high as it could have been if we weren't vaccinated. So the more people get vaccinated, the better it will be. And this is not the only variant that's going to be circulating. It's a war on the pandemic. Again, the pandemic is probably going to last for a few years, and there's going to be more variants like this coming through. So getting vaccinated right now is really, really the answer to kind of protect you, your family, and really be able to get us to keep being open, have businesses, have events and things like that, is really to get vaccinated. So please don't wait. If you've been thinking about it, just go ahead and get it, because it is really the best thing you can do for yourself. It's the most loving thing you can do for yourself, is just get vaccinated.
Let me pile on the. So I don't know exactly what. So one of the benefits of having this forum is that anybody can watch and text in, and if you have feedback on the answers that we're giving you to questions that you text in, please get it to us real time. The drawback is we can't have the dialogue in real time in person, right? As if we were in like a base theater or some type of a room. So the person that asked the question about are we having breakthrough cases on Edwards, the answer is yes. Did that answer your question, or do you have a follow-on question? I'm going to make some assumptions here that, why are you asking, or what's behind the question, or do you have a second question is really it. So one of the examples that I think is a secondary question to that is that I'm vaccinated, right? I'm proud to tell you that I've been fully vaccinated, second shot plus 2 weeks since mid-March. And I recognize, based on the science right now, the statistics and the science right now, that I could be an asymptomatic carrier of the Delta variant. even though I'm vaccinated. Now, that would be a breakthrough vaccine, it would be a breakthrough infection, but Delta variant is the first variant that we have high confidence can be transmitted by vaccinated people. And that is a big change on why Delta is different. So that's the basis of your question, knowing how many people we have that are vaccinated and still got Delta. Are they still in the community, potentially transmitting or spreading? The answer is no, because once you have a positive test or once you go symptomatic and you become presumed positive, no matter your vaccination status, you go into isolation. And that's a minimum of 10 days, and there are some other criteria there. If you have a question about the specifics on that, it hasn't actually changed a lot in the last year plus, and Highlander would be happy to go through those details if you have any follow-up questions. So ask your second or your third question. We'd love to get to them. Let me give you a perspective from my chair. If we were not at the 50% and climbing overall vaccination rate on Edwards Air Force Base, and Delta were crashing on our shores right now, it wouldn't just be coronavirus Delta variant. You know what else it would be? It would be HPCon Delta, right? We would be literally locked down, shut down, no mission, everybody go home and stay home. The Delta variant is that contagious. And you see that in the numbers, and you see that in the public domain a lot. So the reason that we are not at HPCon Delta in the Delta variant, Delta is different, is that a lot of us know how to operate, how to act, how to maneuver through this combat space, and more than 50% of us are fully vaccinated. I will tell you folks, and it's too late, right? But I'll tell you folks that there are some military organizations at other installations where their population is 90+% vaccinated. I spoke with a senior leader about 10 days ago, and their population, all ranks, all ages, but all military, was 92 or 93% vaccinated. That organization is very, very unlikely to have to elevate HPCon levels from alpha and up. And so I'm optimistic, or I was optimistic, I'm still hoping, that we will be able to avoid elevated HPCon levels because of we maneuver well, we have a lot of vaccinated people, but this part of our defense wasn't as strong as it could have been, and it's a 5-week delay. First shot, 3 weeks, second shot, 2 weeks fully vaccinated. It's a 5-week delay to get someone from unvaccinated to fully. In 5 weeks, the Delta variant is going to rip through the remaining opportunity or burn through the remaining unvaccinated population that it has, and the vaccines will still be valuable to you, but the protection for your base, your family, your work unit, and to keep HPCon levels down that opportunity has passed. So that's kind of my perspective on Delta's different, and Delta's a much, much, much more infectious thing. I think we would be at least Charlie, but realistically Delta, if we weren't proficient and we didn't have the vaccination rates that we do have, given the environment. And that portends just how bad it could be if we have a variant that is vaccine resistant or is able to reduce or dodge the vaccine as well. So I'm optimistic that will not happen, but that's what I'm tracking. So thanks for asking that question. Not just a COVID show, but if you want to talk about COVID, we're happy to do it, and we got the experts here. Highlander, you want to talk real fast about, so I'll talk about what happened, and then you can talk about how we're adapting from it. Many of you know that the Med Group clinic itself, the main clinic, had not one, but both of their HVAC systems go down this week. One went down completely, the other was at 50%, and it limped along for a while, and then it died as well. The Civil Engineering Group, thank you folks, thank you team, got temporary chillers there, and we were able to keep a few of the capabilities up and running on and off throughout the week. But it has been a very agile and very dynamic week for patients and for providers and for staff and for the techs that work in the back shops in the main clinic. So if you are any of those categories, thank you for being agile and dynamic. Know that Colonel Lamothe, CE, and everybody that supports you are doing everything we can to get those things fixed and back up to operational speed just as fast as we can. In the interim, we've had to push a lot of other places, push stuff to telemed. Real quick for a quick update status, Highlander, do you want to give everybody what we're at today, and then what we're probably looking at Monday, Tuesday?
Yes, sir. Yes, and I really appreciate everybody coming through and understanding the situation this week. So right now there are some telework. A lot of the main clinical team is at the annex, and we've had to move some of our operations. We are still able to do COVID testing, but our lab had to close for other issues because the equipment was just getting too hot to run, and our X-ray. But and then our pharmacy also had to move because a lot of the stuff had to be moved because of the temperatures in there as well. Hopefully, they are going to have the chillers ready today and be able to cool down the building through the weekend. So we are very hopeful, barring any other issues coming through, that we will be able to be up back to full operation on Monday. But we are advising that people look at our Edwards Med Group Facebook page, because we do put updates on our Facebook page. So please go and like our Facebook page and just follow it so you can kind of see the updates coming out from the Med Group. We are putting out information as much as we can, as soon as we can, to that Facebook page. The other thing I just want to mention to you, sir, is that right now we have one appointment clerk trying to make all the appointments for people and trying to answer questions and field questions and information. She is trying to work her hardest, but we should normally have a lot more appointment clerks. So please just bear that in mind, that when you call the appointment line, there may be a longer wait time because we only have really one person being able to full-time work on that appointment line. We have people jumping in to help out, but it's been a little bit harder. So please be understanding of our situation right now. We are trying to get a second appointment clerk on board as soon as possible. So we are working through some of those logistics. But if you want to send a message to your provider, if you want to make an appointment with your provider, use the MHS Genesis Patient Portal. You can just Google it, but it's also going to be on that Facebook page, and it's also there on the slide. So MHS Genesis Patient Portal, you should be able to use that to message your provider. I've messaged, even though I work in the Med Group, I've messaged my kids' providers, and they were able to call me right back. So it's been very, very useful. If you have any questions, if you want to know your lab result, if you want to do a prescription refill, anything that you want to ask your provider team, please go ahead and use the patient portal. We answer pretty soon that day or the next day. So definitely that's a really, really good way to reach your provider team. You can also make appointments through there. So you just have to search for your provider and make that appointment. And then so you don't have to go through the appointment line. It's very, very easy, very quick. So please take advantage of that MHS Genesis patient portal. You can also find results from your labs. And if you do get COVID tested, you can find results of that COVID test as well through there. So please use that patient portal. It's a really, really good system. You can see all your medical records, and again, be able to message your provider at the tip of, at your computer is really, really useful. And again, your team will call you back. So please take advantage of that, and that will help save a lot of your time and get your answers answered really quick, your questions answered really quickly. So please take advantage of that, but please be understanding that we only have one appointment clerk right now, and we are trying to do our best to make sure we are providing the services to our patients.
Thanks for that update, Highlander. I'm encouraged that we're optimistic about Monday. As you can imagine, things only break when it's the most inconvenient time, and that is what happened with both chillers this week. All right, Chief, any questions rung in on those or related topics?
There's a follow-up question to the one you answered earlier, and they listened and said, okay, I'll give you a follow-up question. Understanding that we can't talk about the breakthrough cases in specifics, can we talk about ratio? Can we talk about, whether on a large scale or just the local scale, those that are vaccinated, we talked about less hospitalization, we talked about less effect, that kind of thing. I don't know that if we have the data, other than local, if we have the data that says, hey, you're about a quarter of a chance likely to be a breakthrough case. Meaning we have 100 people that have infections, 25 of them are breakthroughs. They were kind of asking, can we get that kind of gauge?
Yeah, so we can. So there's a couple things that I want to highlight to folks. The ratio of who gets infected with Delta, vaccinated or not, we have those numbers will exist. They exist for large populations today, and certainly we have them at the installation level. My question, again, I would love to, I really want to talk to you, right? I want to have this conversation with you. My question of you is that the ratio that I actually find more valuable is, of the people that get COVID, what's the ratio of those that get severely ill that are unvaccinated and those that are vaccinated? And the ratio of those that get severely ill unvaccinated to those that get severely ill vaccinated is at least 90-10. Mm-hmm. And the hospitalization rate is almost 99.1. So it's, upper 90%, 96, 97, 98, no matter which community, which hospital, which data poll you search. 95 to 99% of the people hospitalized with COVID, i.e. ICUs, very severe, need oxygen, are unvaccinated. And so the vaccines, as we've been talking about for a while, protect you from being hospitalized and from dying of COVID. They have some significant benefits other places, but those are the big things that they do. To ratios of actual just, hey, I tested positive rates, those are going to be about at what we think the vaccine efficacy is. And as you remember, the banner vaccine efficacy for Pfizer was right at the 91% against the original strain. It is still highly effective, but it's slowly eroding over time in its primary efficacy, but its secondary efficacy against major illness and death remains extremely high. Highlander, any numbers you want to correct to that, or local things that are releasable in the public domain?
So yeah, I mean, yes, definitely concur with what you said. Like I said, the vaccine is very, very effective against even the Delta virus for the hospitalizations and death. Not as efficacious as with the original variant, but it is still very effective. So we are seeing breakthrough cases occurring, it's still rare. I think you have to look at the different situations in the different communities as well. If you have a community that has a higher vaccination rate, like I said, you could have a higher percentage of those cases be vaccinated because the community is having a higher vaccination rate, versus if you have a community that has a lower vaccination rate, that percentage of that community is obviously going to be higher, more unvaccinated. But if you look at the numbers really may be very different from that community to community. So the actual ratios and numbers really kind of depends on the situation in the community. I can say that when I've called patients back that have positive diagnoses, a lot of times the breakthrough cases I'm seeing is just sometimes in family households. And again, this virus is the viral load when you do get this virus is about 1,000 times higher. And that constant exposure in a close house where you're just with each other all the time, it just kind of breakthroughs, your immune system, even if you are vaccinated. So I think context also is very important. But again, this is the reason that the CDC did recommend that we do wear masks when there's a high or substantial community transmission going on of COVID, which, unfortunately right now is mostly in the United States. So that mask wear really does help be the source control, because even though you're fully vaccinated, you may be an asymptomatic transmitter and carrier. Again, when I've talked to patients who have been fully vaccinated, their symptoms are very mild. And that's where I'm going to encourage people. If you have a headache, if you have nasal congestion, if you think it might just be your normal allergies, please just go get tested. It's better to get tested and at least know that at least the test is not detected. And if it's continuing to be symptomatic or continuing to have issues, go test it again. Testing is not harmful to you. Testing will give information to all of us and be able to detect that virus earlier and help stop that spread. But I've had a lot of people when I've called them just say, well, I didn't think it was COVID. Like I just got tested because I was told that, I was just going to do my thing, but it was just a little bit of nasal congestion or a little bit of sneezing, or just kind of felt tired, or just felt a little bit of a headache. But they were kind of shocked. So I'm just going to tell you that if you are having any type of symptoms, just go ahead and get tested. It's better to kind of know than to just think that you don't and continue to go to work or continue in the community and spread that virus. So definitely the vaccinated individuals are less symptomatic than those who are vaccinated. And I am also going to tell you that the times I've called patients who are unvaccinated, and not, maybe this is me just hearing it over the phone, but I always feel like they have a sense of regret that they didn't get vaccinated, and that, gosh, and they've asked me, well, how do I get vaccinated? When can I get vaccinated? Mm-hmm. So, it's just, again, the vaccination does help, and breakthrough cases do definitely occur, but it is definitely not to the level of those who are vaccinated. And if I had a guess of how many breakthrough cases we're kind of seeing in the community it's probably about 10%. Of those cases that are coming through, maybe 10, 15%. So I'll give you that ratio. But again, the majority are those who are unvaccinated. But the whole point of this is that at this point, anybody can transmit this virus, and we do need to make sure that we're doing the mitigations. And I'll take 1 minute to say the mitigations. There's an acronym called SMARTS. So it's S for space, so keep your physical distancing. That is still a thing, 6 feet physical distancing. M is the mask wear, just keep your masks on, especially if you're gonna be around others, especially if you're gonna be around kids. A is for air, so keep it outdoors if you can. R is a kind of restriction on how much size the gathering is, so try to keep it small if you can. T is for time, try to keep it short, and then S is for shots, so get your vaccine.
I like it, smart. It's very nice. I'll tell you, at a personal level, I have had many COVID tests taken personally. I haven't yet one show up other than not detected. But I have been close aboard to some folks that have had their test results come back with positive. It was detected. And the ones that I have been close aboard with that have tested COVID positive, they are significantly more anxious about, okay, now what, than those that are vaccinated. It's a very different psychological battle that I observe in those that have been close aboard with me that have fought through this pandemic. Chief, what do we got rung in?
Maybe the hardest question of the day. How close are we to Bravo?
So maybe we were hot, Mike, when we were talking before the broadcast, Highlander. So that is a question, as you can imagine, that I get a lot. And the answer that I will give you here is the same answer that I would give on camera or off camera today. I'm not going to announce it today. It isn't going to be later this afternoon. I move HP cons in a very deliberate manner. We look at what are the trend lines, what are the indicators, and then if I move Alpha to Bravo, other than the signs changing, what other things are we going to implement as we go Alpha to Bravo? Now, one of the biggest things that change Alpha to Bravo, and certainly Bravo to Charlie, are base access considerations, trying to reduce what Highlander talked about there in the SMARTS acronym, the restriction on the number of people. So that is a significant factor. I can tell you right now, I will not be surprised if we don't see the curve. Well, let me back something up here. If you go look at the rate, you go look at the Southern California pandemic and you look for the bumps, the flares, the waves, whatever you want to call them, right? This curve that we are riding right now is more vertical than anything yet in the pandemic locally. And it is not showing any signs of tipping over or leveling off. And if it shows a sign of doing a square corner over the weekend, which I don't think it's going to do, then I don't think Bravo is imminent. If it starts to tip, maybe we can delay a little bit more, but we're going to be in Bravo in the not too distant future. So I don't know, end of the month, but that's a long way away. We'll certainly be in Bravo. How quickly we get there, don't know. I need to do a deliberate discussion with the customer service organizations, the mission generation folks. Highlander and I need to look at a lot of the data in the area, and then we need to talk about what implementation or what mitigation effects we're going to implement as we go to Bravo. From your perspective as an individual, what are you going to do different today at Alpha versus next week or 2 weeks from now when I likely move us to Bravo? The answer should be nothing. Right? You should still be mitigating COVID in the same ways. The SMARTS acronym is beautiful. I'm going to copy that. Do I have to pay you, Highlander, every time I use it? Pay somebody else?
I borrowed it from someone else.
All right. So it's a secondhand stolen, not copyrighted, I hope. Anyway, you should be doing the same things today that you will be doing if we go to Bravo. The difference then is what does the installation mandate or require us to do on top of that? And those are the considerations that I take in. But in your daily life, there should really be no difference. We are in the middle of a pandemic. We are in the middle of a surge. The Delta variant is different, and it is highly contagious. Now, if you are a mission owner, a supervisor, you're trying to plan a conference or a party or whatever, right? Those are significant considerations, and I owe you some predictability there. Right now, we have not made any decisions, and I'll make so in a deliberate manner. What are the natural on-ramp points for me to get information and then announce decisions? Friday town halls are a place where I can announce decisions. Tuesday morning, we have a COVID CAT meeting across the installation. That is typically where we talk in a closed forum at the controlled and classified information level about if we implement X, Y, and Z, what are the consequences that we haven't considered? And it's a chance for leadership to banter around a little bit and provide some context or inputs. So Tuesday is we're going to talk about it heavily on Tuesday and look at implementation timelines and considerations. And then we usually take a day or two to roll out the update afterwards. So I don't have an answer. That's the best I can give you in what I'm thinking right now. I don't anticipate we're going to jump from Alpha to Charlie, but the likelihood of us not going to Bravo is decreased. Let me give you perspective. We are the only installation left in AFMC that is not at HPCon Bravo. And we were the first to go to Alpha, and we'll be the last from Alpha because you rock, right? Because you care, because you know it, and because you are counter-COVID smart. Continue to do that, and we will continue to be the green dot in a sea of red. And for that, I am very grateful, but it isn't a birthright. We have to continue to fight that way. I don't know what else I can do on that one, Chief, but that's what I got.
Let's be honest. We've probably put out more information on Friday town halls than anywhere else and give more predictability here. So I feel confident in saying that unless something just spikes tremendously, like I wish my stock graph would, unless it spikes like that, they'll probably hear about it here before they hear about it, just drop on them like that.
Absolutely.
So I feel pretty good about that.
Yeah, an example of something that could make us jump pretty quickly are if the medical system immediately bogs down or becomes overloaded off base. It is challenged right now, as it has not been for a while, but it is not showing signs of breaking imminently, and that's another significant factor that we can't control.
So you mentioned mandates, and that was just a good segue to this next question. Any updates on the federal vaccine mandate? Have we had any updates on that? Any predictability?
So I literally, before walking over here from the office to the PA studios at Takatatu, I literally just scanned my email real quick, looking for something from a source that would have announced, hey, SecDef has recommended to the president that we mandate COVID vaccines for active duty folks. President has said, yes, you may do that, even though it's not licensed yet. That's my understanding of where we are in the discussion. It's literally between the Secretary of Defense, Secretary Austin, and President Biden. And when they decide that that is what we're going to do, we'll figure out implementation. But I am not aware of that change yet. There was some press, they weren't leaks, there were some press predictions yesterday that today would be the day. Highlander, have you heard or seen anything different in medical channels or in the news that you watch versus me?
No, sir. I haven't seen anything yet.
Okay, so don't know is the answer to the question. But since you brought it up, once it becomes mandatory, I'm going to call Colonel Lamoth, and I'm going to talk to the vaccine clinic lead, and I'm going to say, you tell me, you tell me, I'll be your supporting commander, how many you want, when you want them there, how early do you want to start, how late do you want to go, how may we put a support team around you of non-medical folks, non-med group folks to max vax the number of people that are unvaccinated that will mandatorily be vaccinated, that go, in our shot records that go red for no COVID vaccine. So that'll be a quick discussion, and that will be hours, not days, before we start implementing and rolling out that plan. My expectation is that we'll likely do something that resembles the tiering. So we'll look at units that are in the Tier 1 Alpha, Tier 1 Bravo, and we'll march down through the rest of the Tier 1s and the Tier 2s as we decide to do that. But we are going to use every single slot. We're going to use every single vial. We're going to use every single syringe. And we're going to have alternates waiting on every single day to make sure that if we have fallout or something happens, that we get the maximum number of people vaccinated in the minimum amount of time. And the throttling mechanism will be what Med Group asks of us, and that's it. I mean, it is. We're going to catch up, and we're going to catch up almost immediately. So be prepared for that. Be postured for that. Let me be very clear. If you are a mission owner, and my direction in coordination with the Med Group to you or your squadron, take everybody that's not vaccinated and move them to the Med Group between the hours of A and B. If that means you don't generate your normal mission that day, that's the right priority. Vaccinations will trump mission execution when they become mandatory. And that's the right thing to do for the long haul, even if it does have some significant mission impact in the short term. So I think that's about all I have right now on that, but I think it's close. if you'd asked me 4 months ago, I would have predicted that we would have a licensure right now, and then it would have been in a normal manner. But looks like we're going to get ahead of licensure if I had to predict. What else, Chief?
Are we going to have services returned to the chapel? I know we might need a phone a friend for that, but
yeah. So if we get a chaplain online, let me know. The thing that I am very pleased with the faith groups and their leaders is that they have found a way to continue to adapt and morph and be agile through the pandemic. I sat outside of Chapel One a morning and watched Chaplain Clark deliver a service and a sermon, and it was fantastic, right? Normally I would have expected that service to have been inside, but he has done an exceptional job with that faith group of keeping them together and keep them practicing, even if it is outdoors, as a mitigation. Folks, this is not the time to push people back indoors and sing and be there for a typical religious service, 60, 75, sometimes 90 minutes. It runs counter to the SMARTS acronym of COVID mitigation that we've seen. When we fall off the backside of this wave, that'll be another potential opportunity, but we're going to follow the lead of the faith group leads. We're going to follow the guidance of the faith group leads on what they want to do with their cohort and their flock. That's I think the best I can answer that question right now. But if you are if you are a Catholic worshiper, talk to the priest. If you are an Episcopalian or something close, then you talk to Jay Clark. If you're Jewish, you talk to your rabbi. You talk to Mike Braun. And you find out what they want to do, and then as a group, you figure out what's in the realm of realistic and how do you balance more benefit and lower risk. How do you balance those two kinds of things? So I'm not going to direct it, but I'm not going to prohibit it. I think that's probably the extent of the answer I can give you in this form.
So we must have hit some buttons between the two of you speaking, because I'm starting to
We
get
always
questions
do. I love
flowing
it,
in,
right?
and we have about 15 minutes left, so we're going to try to
Rapid fire.
get to them. Okay, so how can I get my COVID results if I'm off base? No CAT card reader, no access to my email. Thank you.
So you can call if you just call the COVID hotline, so if you call the appointment line at 661-277-7118, if you choose option 1, there's a way to go to another option to be able to kind of leave a message to get your test results. Just so you know, we are calling everybody who has a positive test result, and we are being able to run the test within 1 to 2 days. So that we have a biofire test, a PCR test that we do. It takes about an hour to run, but obviously we have a lot of tests that we are running throughout the day. So our lab is actually here till after 8 p.m. Every night to run those tests and get those through. So they are working overtime to make sure that we are processing those test results, and we are calling all positives. So not saying no news is good news, but obviously the best way is to go through that patient portal. But if you do need your test result and you're not able to go through the patient portal, just call us through the appointment line, and we should be able to filter that through to get you your test result.
And that number again, 661-277
7118.
7118, and you can option your way through.
Yes.
All right, next.
Any word on the mandate for civilians to be vaccinated, how it'll be rolled out? So how will we roll that out if we heard anything about that?
Yeah, so let me be very clear what I heard POTUS say going on 10 days ago. The President of the United States did not say, I mandate all federal civilian employees to get a vaccine. He did not say that. I would be very surprised if he says that for the entire federal civilian workforce, but he could, right? Some employers are mandating that you have it. In fact, I heard an example today on a podcast of employees that were fired, were terminated for violating their company's mandatory vaccine policy and returning to work. So it would not be unprecedented for the federal government to do that, but it is not currently the policy. The policy right now says if you are a civilian employee of the United States government, to include our government civilians, that you must attest to your vaccination status. And if you are not vaccinated, then you must submit to COVID testing at a specific frequency if you are in a substantial or high area. Oh, by the way, we are, and in fact, most Air Force installations are. So that last part is not a factor. And the reality of that middle ground is if you're not vaccinated and you then must mandatorily test, there has to be capacity test. So I think the order from the president is clear. It has been doubled down on by DoD high-level policy, but the reality is in the implementation guidance. So for example, at this installation, who do we prioritize? Testing symptomatic folks that are also at high risk, or surveillance testing, or if you will, mandatorily surveillance testing civilians that are not vaccinated. Those are decisions that we don't yet have implementation guidance on. We are navigating that to the max extent we can, but that's the status that we're in right now. I have a couple thoughts on that. If you are a civilian and you're not vaccinated, I encourage you to consider getting vaccinated. If you are a civilian that's not vaccinated and can't be vaccinated, then we need to put our arms around you and come up with a reasonable accommodation plan anyway. And that may include testing you for your own protection and those that are around you. So there's goodness in here in figuring out what that battle rhythm looks like based on what you do and on the testing throughput that is available. So that's the best information I can literally, that I have, and it's everything that I have as I broadcast that out to you today.
Sure. And will moving HPCon Bravo affect intramural sports or Child and Youth Services?
Yeah, so I'm going to flip the Child and Youth Services right back to the FSS guy. One of the things that we have demonstrated as a team, and it's a literally big team, green dot in a sea of red, multiple times, is that when I try to get into very specific installation commander decides things, I never get them all done, and there's always a whole bunch of exceptions, and it just bogs everything down. If I need to do that, I will. But for things like intramural sports, or the gym, or the pools, or FSS, or a classified work site, and I can run the list for the rest of the broadcast and then another hour, the people that know the COVID mitigations that are going to work best in their mission area, their work unit, are the leaders in those work units. And I trust you. I trust them. And if they have a question, they can ask up the chain, to include me, on, hey, sir, hey, ma'am, here's what I'm looking at. What do you think? And the right answer is usually a balance of mitigations and mission accomplishment, not fully doing complete mitigation, but that smashes mission. But depending on what your mission is, you may not be able to accept as much risk, so you'll have to do the opposite, the opposite as well. So it really, really depends on what the mission area is and what the mission owner and the facility owner think is best for their places. A quintessential example in our test mission set is that you may have a very different set of COVID restrictions in your combined task force offices or briefing rooms or vaults than what you have when you execute a mission at Ridley Mission Control Center. Because Ridley is a great example of a place where we want minimum, ideally zero, but absolutely minimum spread opportunities because of what we do there and just how vital the operations are that happen in there and the people that staff it. So there's a lot worse consequence if we lose the Ridley staff or the Ridley capability than if we lose any one CTF. So I would expect, as we have in the past, that those restrictions to be different as we increase Bravo. And I bet they are slightly different mitigations today as they have been throughout the pandemic. So now to Child and Youth Services, did I give FSS a chance to text you in the phone, friend?
I was going to say thank you for,
You're welcome,
for speaking
Chief.
so long because
Yeah,
I came back. What they really said was, hey, we're working mitigation plans right now the best we can, and they're thinking through battle scenarios that say, hey, if this, then this. But at the end of the day, it'll really depend on why did we go to Bravo? What were the deciding factors that make us go to Bravo? That's going to be the pushing factor to say, yes, we should interrupt intramural sports. Yes, we should take different approaches to Child and Youth Services and CDC, after school, things like that. So really, it's going to be the trigger points that determine it. It won't be Bravo in and of itself. So as they go through and they're working through their alternate plans of how to take care of folks, it's really an algorithm of if this, then this scenario that they're going to have to figure their way through. So unfortunately, there's no clear answer to that right now because we have no clear answer of going to Bravo or the factors that would send us there at the moment.
Yeah, if I assume Delta rates continue on the path that they're on, but no other changes, and I don't know how those two are compatible, but just make the assumption with me now. I don't anticipate any major changes, if any changes, to any of the customer-facing organizations. We would look to do other types of mitigation in ways to help the Bravo. Bravo would drive other mitigations to help the installation writ large, and then we'd apply the reduced capacity or the reduced service or the reduced time, things like that in very specific cases. So let's go to real quick. I heard I watched the MSG town hall. Right, that was a good. You did a good job herding those cats on that stage, Chief. Next time, take a stick. But what I heard in there is that CDC is going 100% masks for 2 and up for
sir.
everybody in the building.
As of the 11th.
Okay, so as of next week on Tuesday, anybody 2 and up in the building must have a mask on unless you're eating or drinking. But there's some clear exceptions to that. That is a great example of a Bravo-like mitigation step that will hopefully keep capacity up there longer than it would be otherwise. But that's an example of how a mission owner and a facility owner are looking at the environment and staying within the boundaries and making things safer, but keeping capacity and mission open. I don't know how to answer the rest of the child and youth services and the CDC things until we see just how bad we're impacted and what the clusters look like on the base. What else, Chief?
I had one. I have somebody coming back and clarifying for me. As a civilian supervisor, we recently began to bring employees back a few days per week. With the current pattern going the way it is, should they reverse that decision or should they pause that decision? Because they're bringing folks back off the telework, and are we heading towards a trajectory where they say, "Hey, maybe when I hit the brakes on that a little bit"? And
yeah. So there's a couple things there that are guidance level. So the Secretary of the Air Force still has a policy in place that has been in place for, gosh, I think it's 15 months now, that says max telework. I literally had a Teams meeting with multiple people in the Pentagon today, and they were all at home. And I had another Teams meeting with multiple people at Wright-Patterson, and I think 2 were in the office, and everybody else was at home. So telework is still much more prevalent than it was before, and we still have very high level impetus for that. Now, the message that I delivered locally to the senior leadership was, in Bravo and Charlie, especially Charlie, maximum telework compatible with the mission throughput that was possible. Maximum telework compatible with the mission throughput that is possible. In Alpha, as we moved from Bravo into Alpha, then it became telework as it makes best sense for your team and your mission. So there's an expectation in Bravo that it's default to telework if your job can and you can, because you need both. That's Bravo. That's the expectation there. And in Alpha, it goes back to what telework agreement do you have in place and what makes sense based on, have you had a COVID positive in your work environment and everybody's just home? So here's an example. If you're in a work center and you're vaccinated, but you have somebody in your work center pop positive, vaccinated or not, and you're telework eligible and your job's telework eligible, well, go home, right? You don't have to quarantine, but it makes sense, right? So that's an example where even in Alpha, you would go back. So if I'm a supervisor and I'm contemplating starting to bring my folks back from telework next week, I would pump the brakes on that. If I'm a supervisor that started bringing my folks back this week, I would continue that and then wait for us to change. If I started a month ago or 3 months ago when we went from Bravo to Alpha, I would hold steady and let's see why and how things work in your unit, in your squadron, and for your mission as we decide to go to Bravo. Telework is here with us to stay. We need it formalized, we need to be proficient at it, and we need to be dynamic. Early in the pandemic, it was, I'm at work or I'm teleworking. I need us all to realize that this is a spectrum. And when you need to be someplace, then you need to be there. If you don't need to be there and you're eligible and you're effective, then telework is a viable option for you. I don't know how much, I don't know if I can provide any, if there's any clarity that you need or didn't answer your question, please hit us up again. Go ahead.
Absolutely. Nope, sir, we're good.
All
Perfect
right.
timing.
Yeah, so
We're not right.
Highlander, any food for thought that you want to give folks as they walk out the door for a warm summer weekend, but not record setting like it was back in June?
Food for thought. Just keep it, like I said, just take time to be with your family, your friends, but just really keep it safe and just really know that this is obviously not a good situation. We're definitely in a surge, and The peak is still many weeks away, and it's going to, like I said, I do think that our case numbers are going to be just as high as it was in the winter time. So definitely be wary right now of what you're doing right now, because this is the time to really mitigate and really kind of be on that defense. Again, if you haven't been vaccinated, this is the time to get vaccinated, especially with our kids going back to school. There's a real worry, especially a lot of parents are very, very worried about that, about sending their kids back to school without really any defense for them in this situation. So just be, like I said, just be very mindful. If you do get sick, just get tested. If you haven't been vaccinated, get vaccinated. We have vaccines available every Tuesday, Wednesday, and Friday. Pretty much you can make an appointment or just walk through to the med group, but it's available in the community as well. Antelope Valley has drive-through that you can just go and get it done, and it's available for 12 and older. So just make sure that you're doing as much as you can to prevent the virus. The virus is, it's just not fun to be sick, and it's not fun to get your kids being sick as well. And and unfortunately, I've seen a lot of household members with young kids and their kids all getting COVID. And we've had people who have been hospitalized, and we've had deaths from this. So and we're seeing our hospitals going up in rates, and the death rate is increasing as well. So this is going to be kind of a surge, and it's going to have to burn itself out at some point, but it is definitely, we're still in the beginnings of it, and it's going to keep peaking. So don't want to be always a naysayer, but it's the reality of the situation. So again, have the weekend to kind of decharge and just kind of relax, and just stay home and be with your friends and your family. Like I said, keep it outdoors if you can, and as you still be able to enjoy a lot that California has to offer. But I just want to make sure that you're keeping it safe and doing the smarts.
Smarts, I love it. Yeah, I love it. We'll get that on a chart for the next town hall. All right, Chief. Words of wisdom, thoughts, pushing people out the door on a Friday? What you got?
Push people out the door on a Friday. Yes, absolutely. Go home, say I said so. Don't do that. You'll get in trouble. You'll get me in trouble. But what I will say is this. We do have Summerfest tomorrow. Please come out. Be responsible. If you're around and you're in the local area, please come out, enjoy it. Have a good time. Do the things and we talk a lot about how heavy this situation is and how heavy the subject is, and being safe and doing those things. Same time, we got to remind ourselves to, where we can, when we can do it safely, to enjoy ourselves and to enjoy our family. It's hot. It's the summer. You got to take time to do what you can when you can, and this happening tomorrow evening will be great, and it's something that hopefully folks will go out and have fun and get to do. Otherwise, purposely make plans to go out and take care of you and your family. Purposely make plans to find safe ways to keep your summer alive and have as much fun as you can, because God knows we're all going back to school.
Yes,
Otherwise,
school.
have a great weekend, and be kind to one another.
Yes, so lots of exciting things are going to happen over the next day. Every 1 week increment now is going to be more kids back in school, and more changes, and really ratcheting into the fall. Chief foot stomped it. I talked about it earlier. Summerfest tomorrow, Wings Field, which is behind the bowling alley, starts at 1700, but really ramps up about 1900. And then let me leap forward, right? If you are looking for another big event on base, the next thing we're going to have is the Edwards Custom Auto Show. So ECAS is what we're calling it. It is going to be Friday before Columbus Day, which I believe is Friday the 8th of October. Somebody correct me to 100% if that's not true, but it's a duty day. I am going to declare it an alternate duty location for part of the day. So if you're a civilian, you can get there as part of your duty day. We're going to have multiple car clubs, a lot of booths, a lot of other things. If you're a unit commander and you want to build a Wingman Day or Wingman Day-like thing around that event, there'll be a 5K run in the morning. We're probably going to have a bike ride in the morning. And then we're going to have we're going to cap the day off where Club New York is going to have an Oktoberfest-themed food and drink available. So October 8th, Friday, October 8th. If you miss tomorrow, or maybe you hit tomorrow and you still want to get to October 8th, those kinds of things are going to continue, and they're going to be available to us because you are doing the right thing and you're being smarts, I guess plural smarts, about all this. And I'm proud to be a part of the team, very thrilled to be here. Thank you for doing what you do all day, every day in defense of our nation, no matter what color uniform you wear. And I really appreciate you. I really appreciate your family, your sacrifice, and know that we want to hear from you. We take your feedback, we take your inputs very seriously. And I don't know what else I can say other than thank you and thank you and thank you. So see ya. Thank you one more time, and then wish you a very good weekend. And I'll sign off now. So long from Takata 2.